The U.S. COVID-19 emergency declarations finally have an end date. The Biden administration says it will extend both the national and public health emergencies only until May 11th. Various agencies will now determine which federal programs can continue without the order in place and how to unwind programs that can't. The change will also affect Medicaid enrollees and other health care costs. ABC News medical contributor and emergency physician Dr. Darian Sutton joins me now for more on this. Dr. Sutton, thanks for being on. What potential impact will this have on hospitals?
I think a significant one, Diane. Looking at the amount of funding that has been provided by hospitals, it's allowed adequate treatment and innovative care in many ways. For example, at-home testing and treatment, as well as telehealth. When we have these changes that are upcoming, we're likely looking at a significant drop in the revenue to these hospitals, which will inevitably disrupt care to patients and add work to hospitals who are already dealing with a workforce issue. But the most concerning part of this to me is the lack or the fact that we will discontinue automatic enrollment into Medicaid this coming spring, which is projected to affect up to 15 million people. And it makes me feel as though we're starting to create the treatment of COVID-19 as somewhat of a luxury.
States will also soon be exempt from sharing data with the CDC. So what does that mean for tracking case counts and COVID-19 deaths? Will we not need to do that anymore?
We certainly do, and we certainly should continue. You know, something that I've learned in my training and medical experience during this pandemic is that you cannot fix something you're not measuring. So if we don't have adequate ability to know the amount of cases that are out there through certain and various types of testing, as well as, for example, water maintenance testing, then we won't exactly know how to prepare for these upcoming surges that we will likely see in the future. A part of this change was penning the word seasonality to COVID-19, but we've seen nothing like seasonality with COVID-19. Unfortunately, we still are not able to predict it. So I think that that's one of the biggest losses, not being able to track this pandemic appropriately.
So will the end of the emergency declarations impact access to COVID-19 vaccines, tests, or treatments?
It certainly will affect access to testing and treatment for most. Right now, as was stipulated, coverage for vaccines will likely be provided to those with insurance because a lot of those benefits were provided from the prior Affordable Care Act adjustments. But unfortunately, we're going to be looking at a large percentage of people who are uninsured and don't have appropriate access and find the paperwork to enroll themselves to get access confusing, or they may not be English as a proficient language for them. So I'm looking at these inevitable, difficult communities and these groups of people that are not going to be able to get the access to care that they're needed. And that's what I'm most concerned about.
All right, Dr. Darian Sutton, always great to have you. Thank you.
Thank you.
So what are people across America asking about the end of these COVID-19 emergencies? White House correspondent Karen Travers joins me live now for more on that. Karen, you talk to radio hosts across the country every day. So what do they want to know about this?
Diane, big question was, why now? What prompted this change? Why is the administration ending these emergencies on May 11th? But a lot of the questions I was getting asked this morning, and it was very busy, this was a very hot topic on radio, were the questions that Dr. Sutton was bringing up there. Big concerns about what this means for Americans who've been relying on free vaccines, free treatments, and free testing. And as he said, you know, for the most part, Americans that have insurance will be okay to get vaccines, but treatments and tests are going to be a lot less of a guarantee. Senior officials do say, though, that they don't see a potential impact right away in the spring when the emergencies are lifted. But, Diane, they are worried about what happens in the fall because, remember, we've talked about this. Funding was always going to be an issue. The administration was not going to have the funding ready to purchase more tests, more treatments. It was going to shift to the insurance, and this was all going to be part of a private system.
So some Medicaid recipients have been able to stay in the program during the pandemic, even if they no longer meet qualifications. So what does this mean for them?
This means they could be at risk of getting kicked off the rolls. So essentially, because of the public health emergency, if your circumstances had changed, if you were no longer qualifying for Medicaid, you were staying on the system because of that declaration. That will change, though. After April 1st, states will be able to remove people from the program. There was pressure on the Biden administration from some Republican governors who said that during the pandemic, the system exploded, that there were tens of millions of people who got added to it who should not have been on it, and that was costing a lot of money. Diane, there was one study from the Kaiser Family Foundation that said that maybe 13% of people enrolled in the system could get kicked off of it once these rules go into effect.
This could also, Karen, affect issues like immigration. Title 42 has allowed the U.S. to expel hundreds of thousands of migrants in the name of public health. And we saw a surge of border crossings before it was extended last year in a court battle. So what happens on that front when these emergencies end?
It could mean the end of Title 42. Now, that, of course, is a case that's pending before the Supreme Court, which had temporarily moved to extend it. The administration has tried to end Title 42, but they say their hands have been tied because of these court cases. Well, now, if they're saying that there's no longer a public health emergency for COVID, they could move to end the Title 42 program as well and lift those restrictions at the border. Again, another issue they've been under a lot of pressure on from both sides of this. Diane?
All right, Karen Travers at the White House, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.